the mic with you.
Thank you, أختي عنود. صباح الخير. Good morning, everybody. Thank you, Dr. Naji Aboud, for your this great time. And our presentation today was about the Gummy Smile treatment with periodontal plastic surgery with Dr. Naji Aboud. He is periodontologist and implantologist. Dr. Naji is speaker for you. Thank you so much.
Good morning, ladies and gentlemen, and I am very happy to be presenting here. Hope to see you face to face whenever we finish our COVID-19 confinement, and hopefully very soon, as it's getting hotter and hotter and the cases are decreasing considerably. Today I will be presenting, and I would like to thank Dr. Jamal for the invitation, of course. Today we will be talking about how to treat or reduce gummy smile with periodontal plastic surgery. So how to reduce or treat permanently gummy smile. So I won't be talking about Botox because Botox is not permanent. And the treatment are always done in our dental clinic with periodontal plastic surgery. As you know, I come from Lebanon. I hope you visit us soon. Today, it's our first sunny day after a week of rain. And it will rain back on Saturday. We had a very late spring this year. So I hope it will finish soon and we will have a nice weather soon. And we hope you visit us soon also. A lot of our patients these days are asking for Hollywood smile because they want to have a smile and they want to look like the Hollywood stars. To have a Hollywood smile, it is not only sufficient to have white and beautiful teeth. It's a whole display, because whenever the patient smiles, the patient shows the teeth and the gum display also. If the gum display is not appropriate, the smile won't look nice. Imagine the patient on the left side of the screen. We just changed the crowns for her, and we did for her maybe veneers or crowns. Do you think it will look nice after that? I don't think so. She will only have white teeth, but the upper right central incisor will still look bigger than the upper left central incisor. The upper left lateral will look bigger or longer than the upper right lateral incisor, and she will have a lot of gum showing on both sides in the premolar areas. So of course she needs to do a gum surgery with crown lengthening and contouring before doing any prosthetic treatment. So it will look like the patient on the right side of the screen. What is a gummy smile? A gummy smile is an augmented display of gum showing when the patient smiles. So whenever we have more than 2 millimeters of gum that shows on the apical part of the teeth, this is called gummy smile. And this must be reduced if by anyhow we intend to do an enhancement for the patient's smile. What are the causes of a gummy smile? We have many causes for the gummy smile. It could be an excessive display of gum tissue on the upper jaw that can result of abnormal eruption of the teeth. This is called interrupted passive eruption. So the teeth are always covered by excessive gum tissue and also by bone, because it's not only the gum that covers the teeth, it's also bone. There's a second cause. It could be the muscle that have a high hyperactivity and it brings the lip a lot upper, so it shows a lot of gum. And there is also a third cause, which is the hyper development of the maxillary bone. Okay. It could be an excessive bulging protrusion of the upper jaw within the gum tissue. So it would experience an obvious gummy appearance when the patient smiles. And all of these causes can be treated. So how we can enhance our gingival display? How can we reduce or fix or make even an amount of gum showing? We can do this either in the dental clinic by multiple crown lengthening, as we will see next, by multiple crown lengthening and prosthesis, we will see also this, by surgical lip repositioning, we will talk about this also. Or it can be done outside a dental clinic and a hospital by a maxillofacial surgeon by doing a Le-4-1 surgery or an orthognathic surgery. The most important numbers to memorize while doing our treatment plan is the width and height of the central incisors. Let's start with this patient. We use an electronic caliper. We took the width of the central incisor. It's 9.14 millimeters in this case. The height is 9. So it's a shape square. Of course, the length of the central incisor must be longer than the width. And the golden proportions for the central incisors are the following. If we go to the width of the central incisor to number 9, the ideal height of this tooth must be 11.5. So in this case, we can increase the length of the central incisor of 2.5, and we can increase the height of the other teeth according to the central incisor. We also have another diagnostic tool called the Chew probe. It's a probe that was actually invented by someone with the family Chew from NYU, and it is intended to just simplify our diagnosis. Actually, it's a color-coded probe. You can see that we have a width probe and a height probe. The colors must actually be the same. For example, in this case, we see that the width of the central incisor, it's the black coloration. It's the first line in the black coloration. So if we want to have the ideal height, it's the same black coloration on the height. It's the first line of the height. Okay, this probe actually corresponds to the numbers I just gave you in the slide before this one. Also, what is important to us is to work on proportions. Proportions are firstly, they were used by orthodontists, and a lot of proportions are important when doing our job, of enhancing the smile of the patient. For example, when looking at this patient from the facial side, if the lateral incisor is 1, the central incisor must be bigger than the lateral incisor with the average of 1.618. The canine must be smaller at 0.618. Okay. Also, we have other proportions like the buccal corridor. If the buccal corridor, that means the space from the angle of the lip until the center or the zenith of the canine is 1, the distance between the distal part of the canine and the mesial part of the central must be 0.618. We have also another tool that can help us to control the work of the dental technician whenever he sends us his work. This is a ruler that we can place on the work that is sent by the dental technician to check if he actually he worked upon the golden proportions. So as you can see, there are some corridors in which we can place the teeth on them just to control if the display that he is sending corresponds to the golden proportions. Also, an important feature when doing our crown lengthening is the position of the zenith. The zenith is the most apical point of each tooth. That means this is the most apical point of the free gingiva. On the central incisors, it is not centered, so it is a little bit more to the distal. On the lateral incisors, it is a little bit more to the medial line. On the canine, it is completely on the medial line. This must be taken into consideration when doing our crown lengthening and when doing our gingivectomy. At rest, the teeth must show 2 millimeters. So this is important to know this, to know the final height of the teeth, so we know exactly where to place our gum when doing our crown lengthening. The teeth must be symmetrical. The two centrals must have the same zenith level. The two laterals must have also the same zenith level, and so on. Not like the picture I'm showing you here on the right side of the screen, where one central is bigger than the other one lateral is bigger than the other one, and the canine is the same thing. Also, whenever we do our crown lengthening to reduce actually our gummy smile, we must know that the two central incisors are the biggest or the highest points. Then the two laterals are shorter than the centrals of 1 to 1.5 millimeters. The canines must be either at the same level or on of the centrals, or they can be a little bit more apical. The gingival zenith, we talked about it, how it is distal on the centrals, more medial on the laterals, and in the middle when doing the canines. Another number, an important number to memorize, is whenever we are doing crown lengthening, that will be followed by prostheses, veneers, or crowns. We must take into consideration that at the end of our surgery and when having the final outcome, the gums must not be more, the positions of the papilla, the most coronal position of the papilla must not exceed 50% of the tooth height. If it does, then the aesthetics won't be good. So if by anyhow in the final outcome our papilla will reach more than 50% of the height of the central incisor, then we have to reduce the papillas and we have to remove from the bone existent between the teeth. Now that I gave you all those numbers, you can hear if I ask you what is the ideal, is it the upper right central incisor or the upper left central incisor? Of course, you would tell me that corresponding to the golden proportions, the upper right central incisor have a better aesthetic outcome than the upper left central incisor. And to fix this matter, we don't do a gum grafting on number 11, we just do a crown lengthening on number 21. This is an example of a case with an excessive gingival display that can be arranged in a dental clinic by crown lengthening. This is also an interrupted passive eruption, and surely we can treat this permanently in our dental clinic. This is another case that needs that has also a gummy smile that has to be fixed, but also this patient has old crowns that must be changed. So the treatment will be crown lengthening and change of the prosthesis. It was Ingber in 1977 that firstly that talked about the 3 millimeter distance between the alveolar crest and the margins that will be done for the crowns. We didn't know this before that. And he actually explained exactly what is the biologic width and why we need always 3 millimeters between the bone and the margin of the future crown to actually eliminate the risk of having an inflammation. And this is why the procedure called crown lengthening actually was described. So the surgical crown lengthening is a procedure with which the amount of tooth exposed supragingivally is surgically increased. Like in this case, the dentist wanted to place crowns on teeth number 26 and 27, and you can actually here see that the clinical crown is too short and there is no way to place crown. So of course the patient was referred to me and I proceeded with doing surgical crown lengthening, and the doctor will be able to place his final crowns or to take an impression for the final crowns after at least 6 weeks from surgery day. Can we treat a gummy smile by a simple gingivectomy? Yes. It can be done by a blade and it can be done by a laser. Yes, we can. But the question is, if we only treat a gummy smile by gingivectomy, blade or laser, is it sustainable with time? No, it is not. Why? Because as you know, we periodontists, our most important feature is something called biologic width. The biologic width that was firstly described by Gargillo and collaborators in 1961. They explained actually that we have on all the teeth, the natural attachment is 1 millimeter of connective tissue, then we have 1 millimeter of epithelial attachment and 1 millimeter of sulcus. And these features, we cannot change them. Even if we want, there is no way to change them. So whenever we do a gingivectomy and we cut the gum and the bone is still here, so we have, let's say we did a 2 millimeter gingivectomy. So we have now only 1 millimeter of gum covering the bone. The bone will regenerate the gum back. So the 3 millimeters will come back. So whenever you do a gingivectomy for a patient, you control the patient, you will see that after 9 months, the gum came back. And this is what happens to me. A lot of my patients told me that we did actually a gummy smile treatment, but the gum came back after 9 months, because the thing is that only gingivectomy was done and not a surgical crown lengthening with osteoplasty and osteectomy. What are the considerations that we must take when doing a surgical crown lengthening? We must take into consideration the root crown proportions, the overbite, the furcations, the amount of attached gingiva. The root crown proportions are something very critical. Why? Because in all cases, it is forbidden to have a clinical crown that can be bigger or taller than the existent root. So whenever we have to do a crown lengthening, first thing we must do is to take the measure of the clinical crown, take into consideration the amount of clinical crown that we will obtain after doing the crown lengthening. So let's say the height is 6 and the amount that we will obtain after crown lengthening will be 8. We take also the measurement of the root. We take an X-ray with a Rin angulator. Let's consider this is 11 millimeters and we have to remove 2 millimeters. So the height of the root will be 9. So 9 millimeter height of the root and 8 millimeter the height of the crown, this is acceptable. The overbite actually is an advantage when doing a crown lengthening, because we can reduce the incisal line in this area and we can increase more the gingivectomy on the apical part of the anterior teeth without actually making the teeth clinically look much bigger. The furcation area are also important. When doing our crown lengthening and osteectomy, we must not reach the furcation area, especially on the first premolars, upper first premolars, and upper and lower molars. The amount of attached gingiva is also important, and in all cases, we must always keep at least 2 to 3 millimeters of attached gingiva around the teeth after doing our gingivectomy and crown lengthening. And in a lot of cases, we have limitations. This is a patient that came to me. Of course, she has an interrupted passive eruption that is causing a very showing gummy smile. I placed some marks on the gum showing the patient where we can reach, where the crowns will be after doing the crown lengthening. And we are showing her that we cannot actually, in this case, completely reduce our gummy smile, but we can enhance her smile. Whenever we make this kind of reduction, the smile enhances of 80 to 85%. So in maybe 90 to 95% of the patients are really happy after doing this procedure, even though the gum is not completely eliminated. Let's see this case. This is a patient that consulted me to see if there is any possibility to reduce her gummy smile. Here we see that the height of the teeth, it can be increased if we compare them to the golden proportions. And we have another advantage in this case. We have a lot of bone exostosis on the buccal side of the maxilla. And as I will show you next, and there is a study about it, whenever we reduce those exostoses, we will have a lip dropping. So in this case, we will increase the length of the teeth, and we will actually make a lip dropping. So the teeth will come up and the lip will come down, and you will see the treatment. This is the patient before doing the surgery. We started by fixing the incisal lines to make them even and parallel to the eyes before doing our surgery. We did this with, of course, a diamond burr. And we took our measurements, which are really the most important thing to do before we start the surgery. We took the width of the central incisor. In this case, it is 9 millimeters. According to the golden proportions, the height must be 11.5. So we mark the gum with a probe at this stage, 11.5, and we have a bloody point on each side. As you can see, this bloody point, which is intended to become the zenith, it is not in the center of the central incisor, it is a little bit on the distal. And the gingivectomy is done according to this point. So we started the gingivectomy on number 21, then on number 11, then on all other teeth according to the considerations we talked about before showing you this case. So the gingivectomy is done, then an intracircular incision is done, a full thickness flap elevation. Then we start by doing the bone reduction around the teeth. Then we remove all the exostoses that are shown. As you can see in this picture, we have 3 to 4 millimeter of bone width in the molar region. After the reduction, we have now between 1.5 and 2 millimeters. Those 2 to 3 millimeters that were reduced are really necessary and important for the lip dropping, as you will see in the result next. So this is the surgery after doing the gingivectomy and the osteectomy. So we reduced a lot of bone on the buccal side of the teeth, and this is the sutured case. We use separate sutures, and we have to be very careful in adapting back the papillas in exact position. So this is the case before the surgery, and this is the case after 2 months from surgery. This is the patient smile. This is a lateral view. This is the 2 pictures on the upper screen are the before. The 2 pictures on the lower screen are 2 months after the surgery. So this was before, and this is after. Showing you before and after pictures in all directions. So this was before, and This is the patient's smile after a complete and drastic change for this patient. Imagine we did all this without touching the teeth, without doing any veneers or crowns on the teeth, just doing a gum display enhancement. That's another patient, same case, gummy smile, without touching the teeth. The crown lengthening was done exactly in the same technique, taking the width, the height, doing the gingivectomy, removing the excess of gum, elevating the flaps, doing the bone reduction, closing back. So this was before and this is after. The flash in the after picture is not the same as the before. This is why we see it a little bit less, more dark. The teeth are still with the same color. So this is before and this is after. Whenever we see a patient like this in our dental clinic, the first thing we think about is we say there is no way we can treat this in a dental clinic. It's a really increased gummy smile, and we say probably the patient needs orthodontic surgery in the hospital. But according to my experience, I see things a little bit more differently. I see that in this case, first, yes, we can gain a little bit of the teeth in the height direction according to golden proportions. Maybe we can increase the central incisors of 1 millimeter. Maybe on the other teeth we can increase between 1.5 to 2 millimeters. But the most important feature in this is the existence of lot of bone exostosis on the buccal side of the teeth. You can see them from this view. And if we reduce those bone exostoses, surely we can hope to have a lip dropping. And this is what I tell my patient, because sometimes we really don't know how much the lip will drop. And I tell them, of course, we can have a lip dropping, but we don't know exactly how much we can have. Surely we can enhance your smile, but maybe after that, we might do a surgical lip repositioning. As you will, I will show you this technique at the end of this presentation. Okay, so I told the patient we can try and let's see what we can get. But I was really optimistic. So this is the patient. As you can see, the height of the teeth can be increased. So we started by doing the gingivectomy on the first picture. Then we opened the flap. This is before doing the osteectomy. This is after doing the osteectomy and osteoplasty. And this is after doing the sutures. This was the case before. This is the case after. You see we increased a little bit the height of the teeth. But the most important thing is the lip position and the lip volume. Imagine this is a lateral view. This was her pictures before doing the surgery. And these are her pictures after doing the surgery. Just look at the gum display here, the gum display here, the lip volume here, and the lip volume here. I will show you, and I will show you next, that how we can increase the lip volume just by doing crown lengthening. Okay, this is the patient before and this is after. What is most important is her face. Imagine this is before and this is after. This surgery is done in our dental clinic. Yes, we can give the patients this result and the patient is really happy. I was not maximally happy because I saw that the two central incisors, there is a difference of half a millimeter between the two centrals. At this stage, after a month and a half, I did a small correction surgery just to bring the upper right central incisor exactly at the same level of the upper left central incisor. Okay. So this video is just to show you how this surgery is done. So the gingivectomy actually starts always on the central incisors, and we go distally from each side because the central incisors are the most important teeth in this procedure. So gingivectomy is done on the central incisor, then on the lateral, then on the canine, then on the premolars, and so on. You can here see that whenever we are doing the gingivectomy, we are not cutting the papillas. The papillas must stay in place, especially if the patient will not be receiving any prosthesis after. So we don't remove the papillas. Second incision is intracircular incision that is done on all the teeth. I also do a palatal incision because I open the palatal flap when doing the surgery. Even though I will not be removing any gum or bone from the palate, I just do a reflection of the palatal flap just to eliminate the soft tissues that will be coming from the embrasure areas. Because if the palatal flap is still in place, I will have some soft tissue on those areas, and it will be difficult for me to see very well and evaluate the bone level in the embrasure area. So here we are doing the osteoplasty. We started by the surgical zikria, then by a round burr. In some small areas, we use a manual bone chisel. Then at the end of the surgery, of course, we must do separate sutures, and we must close all the papillas. In cases that are actually receiving orthodontic treatment, and whenever those patients need to have an elimination of their gummy smile, I always tell the orthodontist that please finish your treatment, and then I will do my surgery later on. And this is what I tell the patient also. But unfortunately, sometimes the orthodontists need to do the surgery before, because in this case, the orthodontist needed to bond the bracket a little bit more apical, because probably he had to do some torquing on the teeth, and he couldn't do this. Imagine the bracket here were completely on the gum. A part of them were on the gum. So we needed to do the crown lengthening just before he finishes the orthodontic treatment. And this is what was done in this case. It is a little bit difficult to do the osteoplasty when having the brackets in place, okay? It takes more time, but in this case, we are obliged. So this was the case before. This is immediately after surgery. And this is after, I think, 2 weeks when we removed the sutures. Okay, imagine the height of the teeth before and after. And this is a drastic change. That's another patient that had a gummy smile. That's the daughter of a dentist I work with. She sent to me her daughter just to enhance her smile. Here I can see that, yes, we can enhance the height of the teeth. And please, I want you to take a look at the upper lip, the volume of the upper lip. Because of the gummy smile sometimes and the hyperactivity of the muscle, whenever the patient smiles to the maximum, the lips goes to the inside, and the upper lip just looks too small. The volume is too small. And you can see the result just 6 weeks after surgery. See the reduction of the gummy smile, the enhancement of the smile, and take a look at the volume of the lip. See how bigger it became. And this is something we can do, and the result is permanent. It's not fillers that will last just for months. It is permanent. So no fillers were added in this case. I want you also to take a look at this small black triangle between the two centrals. That sometimes happens because of a suture, that sometimes the suture is too tight in this area. But I will show you the patient after 6 months, and you will see that this black triangle completely disappeared because we didn't remove any of the gum or the bone from between the teeth. That's another case of a patient. He actually consulted us because he had a blue coloration on tooth number 11. The blue coloration was coming through the gum, so we can guess that probably he has an endodontic treatment. The root has changed the color, and the color, the grayish color is passing through the gum. In this case, we had two options: either to just do a gum grafting to reduce the coloration transparency or translucency from within the gum, or a second option that I decided to do is to do a crown lengthening. Why a crown lengthening? Because we can reduce the gummy smile and the grayish color will be more apical and it will be covered by the lip whenever the patient is smiling. So in this case, of course, he had crowns. We had to remove the crowns, place temporaries, do our crown lengthening, and finish the job. This is I will show you here. This technique here is how to do a temporary crown for the patient during the surgery. So we start by I start by actually a good coordination with the restorative dentist. So he draws me this small map to show me how much gum he needs on each tooth to have a perfect combination and perfect proportions. I start by drawing the lip line, where does his lip reaches whenever he smiles to the maximum. And we draw a line on the gum, and we started to do our gingivectomy. We removed the gum, and in this case I removed also the papillas. Why I removed the papillas? Because as I showed you at the start, the papillas must not exceed 50% of the total display of the incisors. So the gum was removed. How do we do this surgery? We use two chairs. I start with one chair, I do my gingivectomy, then the patient goes back to the prosthodontist. He removed the old crowns. He prepared the teeth until the gum level I gave him after the gingivectomy. He placed temporary crowns. Then the patient comes back to me and I do my crown lengthening. And of course, I must put the bone at 3 millimeters away from the level he gave me on the teeth. This is the temporary crown. Okay, and these are the final crowns that were placed after 3 months from the surgery. This is before and this is after. I didn't like too much the coloration, but these were the patient requests. As you know, sometimes the requests of the patient do not correspond to our aesthetical point of view. That's another patient, 43-year-old lady with gummy smile and defective crown. The treatment was done with the same technique. So we did the gingivectomy, then the prosthodontist removed the crowns. The temporaries were prepared immediately after doing the gingivectomy. Then the patient came back to me. I did the crown lengthening. Then the temporary crown were placed. So this was before, and this is the treatment after placement of the final crowns. Another patient, 45-year-old patient with defective and colored anterior restorations and a gummy smile. So we did the gingivectomy. Temporary crowns were placed. So that was before, and this is after doing gingivectomy, not gingivectomy, crown lengthening, surgical crown lengthening. And those are the final veneers or crowns placed on the teeth. Can we do a lip repositioning and volume increase just by doing surgical crown lengthening? I already showed you how we can increase the volume of the lip just by doing this technique. And we can reposition the lip because we can create a lip dropping after doing this technique. It was Ribeiro in 2012, he's from Brazil, that first described the lip dropping that can happen after doing a crown lengthening. Okay, on this subject you can find maybe 3 to 4 publications, not more than this. That's a patient. She's not happy with her smile. She has, as we can see, extraorally, she has a gummy smile on the right and on the left of her upper jaw. Okay, she doesn't have a gummy smile on the central incisors. The gummy smile is only on bilaterally. Can we do something for her? So this is her maximum smile. First of all, we see that the two central incisors, or the 4 incisors, we cannot increase the height of those incisors because they correspond to golden proportions. What can we do? We can increase the height of the canines, we can increase the height of the premolars and molars, but the most important thing, look at the amount of bone, of bulky bone that we have on the buccal sides. If we reduce this bone, surely we will have a lip dropping and also an increase in the volume of the lip. And this is what we decided to do. So the gingivectomy was done, and then the osteoplasty was done vertically to put the bone 3 millimeters more apical to the limit that we want. And you can see here also the amount of buccal bone that we had just buccally on the molars and premolars. We had more than 6 millimeters. We don't need more than 2, so we removed like maybe 4 millimeters of width. And you will see the results. So this is before, and this is after. So that was her smile before during the surgery, and this is her smile after. So imagine, without even touching the incisors, without even increasing the height of the incisors, see how we could enhance her smile. See how much lip dropping we created. See how much volume we gave the lip after doing our surgery. So this was before, and this is after. That's another case. Whenever we see a case like this, we will say, probably we cannot do anything about it. But according to our experience with this, first thing I realized is the bulkness of the bone that she has on the buccal side. And we see that if we increase a little bit the height of the teeth, some of them actually we can increase a lot, and we reduce all the buccal exostoses, we can increase the height of the teeth and we can create a lip dropping. And this is what was done in this case. And before I started the surgery, I told the patient that maybe we will do crown lengthening, and maybe later on, if this is not sufficient and you're not happy with the smile, we can go and do a surgical lip repositioning. And this is what we started to do. So we did our crown lengthening and see the level of the lip after the surgery, see the height of the teeth. This is a lateral view, this is before, and this is after, a really drastic change. This is before and this is after. At this stage, the patient told me that I'm really satisfied of the result and I don't want to go and proceed of doing a lip repositioning. I'm really happy with the result, and I was really happy too. Also, another case in which we will say since the start, there is no way to do anything about it. But as you can now know, we can increase the height and we can reduce the bulkness of the bone. We can see that we have a width and height of 9 millimeter on the central incisor. So the central incisor can be increased of 2.5 millimeter, reached 11.5. We had 9 millimeters of gum display showing on the apical part of the central incisor, and the lip was just 4 millimeter width in this case. So everything that was done according to our protocol. This is before and this is after. Imagine the lip volume that was obtained after the surgery. This is an article by Silva showing that the aesthetic crown, this is published in the Journal of Clinical Periodontology in 2015. And he showed that whenever we are doing aesthetic crown lengthening for the patients, This resulted in high levels of patient satisfaction and predictable and stable outcomes in the short term. And I can assure you, because this technique, I'm doing it since more than 20 years. So it's not only sustainable and stable outcomes in the short term, it is stable in the short and medium and long term. Okay, I will just skip some cases because those are repetitions. That's a patient also that was referred to me. She's a 30-year-old lady. Really, she has a beautiful face, but whenever she smiled, her smile was really awful. We could only see the gum and a part of the teeth. We couldn't see the teeth. So some of the teeth were actually covered by the lower lip, and the upper lip was going too much up. Okay, so we had like between 5 and 8 millimeter of gum display on the teeth, so a lot. So there was a really considerable gummy smile. Our diagnosis and treatment plan was to reduce the incisal line of the teeth, to do a crown lengthening to elevate the gum more apically between 3 and 4 millimeters, and of course placing crowns on the teeth later on by the prosthodontist. So the surgery was done, and the prosthodontist placed his crown after 2.5 months. Okay, this is the result. This is before, this is after. This is a lateral view, before and after. This is the patient's smile before, and this is her smile after. A really big change in her smile. Of course, personally, I would have preferred a less white coloration, but you know the trend. That's another case. Patient having uneven gum level and gummy smile left and right. The gum around the central incisor was not really round and beautiful, so we decided to do for her crown lengthening, and the crowns were done just 2 months after surgery. So this is before, and this is after doing the crown lengthening and the placement of the final crowns. And this is her lateral view before and after, and this is her face before and after. That's another case of a patient also having she has a gummy smile, she has an interrupted passive eruption, and she has also a lot of teeth grinding. Okay, so we have to treat all this at the same time. We decided to do for her a crown lengthening, and the prosthodontist will cover her teeth with veneers or crowns. So this is the patient smile. Of course, we started by taking the measurements, the width and the height, as you know. The gingivectomy is done. Intracircular incision buccally, intracircular incision palatally, full thickness flap and flap elevation, buccally and palatally. We mark the teeth before doing our crown lengthening, and we start our crown lengthening with surgical zechria. We go to 3 millimeters beyond our line, then round burr to remove all the negative aspect of the bone. Final sutures, and then the final situation. That was before, and this is after our surgery and after placement of the final crowns. You can here actually realize the health of the gums around the teeth. They are really healthy. That was before. This is final situation. That was before, and this is after. I always would like to show the face of the patient, because you can see the drastic difference whenever you see all the patient smile and not just the mouth. Now we'll be talking about the combined procedures. Combined procedures is when doing crown lengthening and another thing at the same time. This patient consulted me some years ago, maybe 3 years ago or 2 to 3 years ago in this situation. I can guess that the temporary crowns that were here in place were hiding something, and this is what I realized when I removed her temporary prostheses that were fabricated by the dentist that referred to me, the patient. I realized a really big mess. There was a big hole in the gums, so we can here guess that we have a big vertical and horizontal tissue loss. The patient told me that she had a car accident and this is what happened to her. So before starting the case, we have to know that this is a really difficult case. First, because we have a vertical and horizontal loss of an anterior, this is an anterior sector. And second, and most important factor in this case, the patient had a gummy smile. So anything that will be done in this case will show to the outside. So it is really important to know where we are going before we start, because we will have a big problem with the patient if our treatment will not reach really good aesthetics and good display. To bring things more complicated, whenever I was doing my intraoral examination, I realized that the patient had already implant placed in a very apical position. Imagine this patient with her dentist that placed for her implants, having them restored, and having a central incisor on the upper left that will be higher than the central incisor on the upper right of more than 5 millimeters with a gummy smile. This is a 28-year-old patient, female patient, really beautiful and working. She works. Imagine this, the final situation. And to bring things also more complicated, imagine the lateral incisor, which is also higher than the central incisor on to number 22. 22 will be the biggest tooth in her mouth when she is actually smiling. So I took the x-rays, and here we can see that there were completely osteointegrated implants in place in a very apical position. We see on tooth number 11, we had also an apical reaction, apical infection. We took CBCT to control better. On the CBCT, it showed us more problems because the implants that you can see in a very apical position, unfortunately, on the CBCT, they showed also that they didn't have any buccal bone. So imagine the position of the buccal bone, how much apical it was if we compare it to the original bone. So it was too much apical, and much more apical than the gums showing whenever the patient is smiling. So our treatment plan was to do everything on different stages. We never do such a treatment all at once. We have to do it at different stages. So our first thing to do was to remove the 2 implants and to wait for 6 weeks until a complete closure and healing of soft tissue. Also, we were intended to have an extraction of tooth number 11, of course, but we decided to keep number 11 because we wanted to take advantage of the we wanted to keep number 11 just temporarily to help us with the vertical regeneration. I will tell you why. Then to do a crown lengthening to bring the levels more close to each other. Crown lengthening on the other areas, on the other teeth, all the teeth except the area where we are doing vertical regeneration, and then to do the prosthetic treatment. So first thing we did is to remove the implants. They were removed without doing any surgery, just by using special instrumentation and untorquing the implants from place. It was not too difficult to do, as the implants, they had only palatal bone. There was no practically buccal bone on them. So they were removed, both of them. So at this stage, we thought about maybe removing number 11 as we are supposed to do, or just keep it for the vertical regeneration. As you can see here on the mesial of 11, we had a lot of tissues, gum and bone, and we thought at this stage that if we keep number 11 for now, this would be helpful for the lateral migration of bone cells from this area towards our grafting area. And this is what was decided. So we started the surgery. The incision to do the vertical regeneration actually has to be 2 teeth beyond, 2 teeth from the mesial and the distal part of the surgery. So 2 teeth away from each side. Incisal, also crestal incision in the area. Whenever we reflected the flap in full thickness, we realized that the apical infection that was existent on tooth number 11, that we thought that we could keep just to help us in the vertical direction. So this apical reaction was reaching the area where I will be placing my bone grafting. And this is a high risk to place bone grafting in an area where it had an infection. It has an infection. So at this stage, we don't take any risks, especially for this patient that also already had too much surgeries and too much failures. So we decided just to do an extraction of tooth number 11, and we did a good curettage for the bone to remove all aspects of infection from within the bone. We closed back everything, and we came back after 6 weeks. We did the same incision. We wanted to do the vertical bone regeneration at this stage. So the same incision. We tried to be in the same scars. We did our incision in the scar that were created in the first surgery, not to create more scars. And at this stage, you can realize that we had 6 millimeters of vertical bone loss on the palatal sides, and we had 12 millimeters of vertical bone loss on the buccal sides. So we had to regenerate all this. Whenever we do vertical bone regeneration, the bone that is used has to be a mix of autogenous and xenograft at a ratio of 50-50. The best place to remove the bone is the ramus area. It's the most simple and the quickest way to remove the bone. The membrane that is used in this case is a titanium reinforced membrane. This is a non-resorbable membrane, expanded PTFE membrane. First of all, we fix the membrane with screws and mini pins from the palatal side. We place the bone until we reach our desired level. Then the membrane is closed, and at this stage, we use the sausage technique, which is placing bone after even fixing the membrane from the buccal side. We keep on placing bone, and then we close completely the membrane. The flap is completely closed over the grafting. The sutures that are used in this case are a mix of horizontal matrix sutures and separate sutures. The patient traveled and she came back 9 months after. You can realize here, first thing, that she has a lot of plaque, even though we told the patient to brush really well this area. But we can understand that psychologically the patient is really afraid to touch this area. She told me, I'm afraid to touch this area. I won't be brushing very well. I would just clean very slowly. So we can understand the psychological effect that she has. But the good thing about it is that the hole that we had at the start, it has practically disappeared. And the level that we obtained is really acceptable. You can realize the vertical gain that we had in this area. So at this stage, we decided to remove the membrane, to do the crown lengthening on the other teeth, and place the implants. Okay, so the crown lengthening was done on the right and left sides. We reflected the flap. This is the membrane in place. We remove the membrane. Imagine the amount of bone that we obtained after this vertical regeneration. So this was the case before doing our vertical regeneration, and this is the case after doing our vertical regeneration. We really gained vertically and horizontally. So the crown lengthening, the osteotomy was done on the right and left. Imagine the amount of width that we obtained. The implants were placed in ideal position, and then temporaries were placed on the implants. And see now the gum levels on the right and left side, and especially in the middle, in the frontal side, really acceptable. So this was before, and this is after. This is the temporary also in place. This is another set of temporary. The prosthodontist was working on increasing the volume of the papilla, and I didn't see back the patient to see her final prosthesis. So this was the temporary. That's another case of a combined procedure. I will be as fast as possible because I think that I have maybe 5 to 10 minutes more. So this is a patient that was referred to me by an orthodontist to place lateral implants in the lateral incisors that were congenitally missing. At first sight, we can see many things. First of all, we have concavities in those areas. So we can guess that we have a lack of bone in the width direction. Second, the patient has a gummy smile. Can we treat all this? We will try. So the x-rays were taken to just first of all check the direction of the roots if it is feasible to place implants, and here it is. The direction of the roots is okay. The CBCT confirmed that there is not enough bone to place implants. Here on number 12, we had maybe 3 millimeters, and on number 22, we had 4 millimeters. And in both sides, we had to add a little bit of bone when doing our surgery. On number 12, we decided to do bone expansion, bone splitting, and to add more bone on the buccal, and also to add more bone on the buccal of number 22, and to do gum grafting on both sides. So it was a surgery where we did bone splitting, implant placement, bone grafting on the buccal, gum grafting on the flap. As you can see, we added a connective tissue graft on the flap and a crown lengthening on all other teeth. Okay, so it was a big challenge to do everything at the same time. But in those cases, this is the best treatment to do. So we start by doing the crown lengthening. Second, it is the bone grafting and the bone splitting. Third, the implant. Fourth, the gum grafting. So this was the case before doing our treatment, and this is the case after doing our treatment. See the smile that first of all, we reduced the gummy smile. There is no more gummy smile. There are no more concavities because we fixed this with bone grafting and gum grafting. And the implants were placed in ideal position. And you can here realize the aesthetic outcome of the crowns and the good adaptation in this smile. This is the patient face before and after. Okay, that's another case also of before and after. Oh, this is a series of before and after. This is before and after, before and after. Same, just to show you what we can do with this technique. Really brings drastic changes to the patient to whom we treat. Okay, before and after. So all majority of those cases are done without doing without touching the teeth. Okay. In this case, no, the patient first thing, she wanted to close the diastema and the opening between the two central incisors. If we try to close the diastema here without doing any crown lengthening, the teeth will look really awful. So the treatment was to do a crown lengthening to bring the papilla here more apically, to gain more space to close the diastema without distorting or having any distortion in the shape of the central incisors. This is before and this is after. Same thing, same thing. Before and after, just to show you that a lot of my patients, between those 5 ladies you saw, 3 of them are dentists actually. This is before and after, before and after. I will go fast here just to be on time. Okay, that's another case of a patient, 60-year-old patient with defective removable prosthesis and a gummy smile at the same time. So he had a prosthesis that was actually fixed with overdenture on natural teeth, but he had decayed and the teeth were mobile and they had to be extracted. So we took an X-ray, and our treatment was to remove all the teeth, to remove from the bone, to reduce the gummy smile, to keep 15 millimeters of bone in the height, just to place 13 millimeter implants, and to place 4 implants and to do a Dolder bar and overdenture on them. So the treatment was, we removed the teeth, we did the crown lengthening, we placed the implants, and this is the final outcome with an overdenture without any acrylic in the palate and a Dolder bar. And at last, I will just describe for you the other technique, which is called coronally positioned mucosal flap, or the surgical repositioning of the lip. This procedure is done only whenever we cannot do a crown lengthening. What are the cases where we cannot do a crown lengthening? Whenever we have long teeth and a gummy smile. So we have long teeth, we cannot increase the height of the teeth, there is no way to increase the height of the teeth, and we have a gummy smile. At this stage, we can do this kind of flap. It's called the coronally positioned mucosal flap. The incision is done like this. We remove in a partial thickness flap all this mucosa, and the upper part is sutured on the lower part. So this is a case where this is actually indicated. Long teeth and a gummy smile. Okay, so in this technique, the incision starts in the mucogingival junction. This is the coronal incision. Okay, we start at the second premolar and we end on the second premolar on the other side. The upper line will be more apical, and the distance between them must be double the needed amount of reduction of gum display. Let me explain. If we have 5 millimeter of gummy smile, we must remove 10 millimeter of height of mucosa at this stage. Okay, so after we remove this mucosa, we suture back the upper part to the lower part. The most important feature in this surgery are the sutures. If by anyhow we lose sutures during the healing period, we can end up having uneven gum, uneven smile, and the patient can smile. Her smile can be not symmetrical left and right. So it's very important to do really good sutures. And we ask our patient not to put her lip up and to see what happened in this area during the healing period, because the patient will actually remove the sutures before the time. Okay, so these are the pictures of the surgery and the sutures. Okay, so that was before the surgery and this is after the surgery. In this picture, it's not that the patient is not smiling. She is smiling to the maximum, but now she cannot put her lip more apically. So that was her smile before, and this is her smile after. That's another patient with the same indication, long teeth. We cannot do any crown lengthening. She even has some gum recessions. So the only thing we can do in this case is the same technique, doing surgical lip reposition flap. Okay, that was before the surgery, and this is after, before and after. Okay, that's another case also. We did the same technique. I wanted to show you this case that because in this technique we might have some patient can recede, okay, and we don't know, until today we don't know who are the patients that will recede and who are the patients that will not, because some will not recede and some we will have maybe 50% of receding, and some of the patient will have less than that. Okay, so this patient, we did for her the lip reposition flap, the lip repositioning, surgical lip repositioning. You can see before and you can see after. And I will show you just 1 year after. You can see that the lip went up a little bit more, up, more apical. Okay, it didn't come back to its original position, but we lost a little bit of what we did. So this procedure is only done when crown lengthening cannot be done. Okay, so in conclusion, we have to know what are the patient wishes before we start. We have to coordinate very well between cosmetic dentist and periodontist. Okay, we have to know exactly what we want before we start. We have to be the most conservative possible, and you know, we are periodontists and we are really conservative, and we have to know our limitations. And I would like to thank you very much for your attention. If you have, I will answer some questions now that I can see here, but if you have any more questions or you want to contact me, you can find me on Facebook, Naji Aboud, or on Instagram, Dr. Naji Aboud. It is really very simple to communicate.
Thank you so much, Dr. Naji. I sent for you 3 questions.
Yes.
Can you read it and answer, please?
Yes. First question, if the post-operative sensitivity is common and how to manage. It is not common. Maybe my percentage of sensitivity is maybe 2 to 3% of the patients, and the sensitivity, if by anyhow it happens, it is really temporary for some weeks and then it disappeared. Why we don't have sensitivity? Because the majority of those patients, we don't go beyond our enamel, cemento-enamel junction, so we don't put our root on the without any gum. We don't remove the gum around the roots, so there is no sensitivity. The second question is, do the patient have sensitivity of crown? Same question, we answered already that. The third question, do buccal exostoses reform again after surgery if teeth are subjected to stress like ortho treatment? If the patient receives another traumatic ortho treatment, like what happened to those patients, maybe it can reform back, but I didn't see until now patients with recurrency or they receded back, so the exostoses cannot come back. And as you know, in general, we don't do any orthodontic treatment after our surgery. The orthodontic treatment is done before. Okay, I hope I answered all the questions. I don't know if you have any additional questions.
Until now, I don't have any additional question. Any question?